Adele Jones, OBE, is a professor of social work from both the University of Huddersfield and previously the University of the West Indies. Throughout her career, she has specialised in international children's rights and research to prevent violence against women and children. And Ni3 is here today thanks to her, really, having been her brainchild from the outset, building on her extensive experience of leading international research projects in this area, particularly on earlier research funded through UNICEF and the European Union. The GCRF project's been a huge collaborative team effort, but one which really thrived and found wings under Adele's guidance and leadership. And she joins us, I'm pleased to say, live this time, and we're hugely grateful to her for taking time out from her well-earned and still very recent retirement to talk to us today. So welcome, Adele. Over to you.
Thank you. Thank you very much, Ross. Okay, wow. Ross, just listening to you in terms of reflecting over the last 4 years, I am very humbled. I am very privileged to be asked to speak here at this closing conference. And I'm also incredibly stunned by the overwhelming achievements that we've managed to pull off. And I know how difficult it's been because I have walked every step of that way with every one of you. And I feel incredibly emotional. It is 4 years ago that I was standing at the University of Huddersfield to welcome our partners in our launch event. And what I want to do today is I don't want to reflect on the past. I think that's wonderful. I have to see that. I have to see why I have so many grey hairs, notwithstanding the hair dye. I have to see why. But I think what I want to do today is something different. I want us to think about the future. And so I'm going to talk about something entirely different from what we've done in Ni3. I want to present to you a strategy for countering violence against women. And you will note that the word terrorism is crossed out, and that is purposeful. There have been recent calls for violence against women to be treated with the same urgency as terrorism. And in my talk today, I explore what such an approach might mean in practice. The violence starts early. By the time they have reached their mid-20s, a quarter of young women in relationships will have already experienced violence by a partner. They have joined the 736 million women and girls who have been subjected to physical or sexual violence, the 1 in 3. Across the world, the prevalence of violence against women has remained largely unchanged for over a decade. Until COVID, that was. As Ross said, since the pandemic, the situation has worsened. Social isolation has triggered an increase in the reporting of all kinds of violence against women and girls. In the UK in 2020, police reports showed a 9% increase in domestic violence crimes compared to the previous year, and sexual offences tripled. And these were only reported crimes. Ross mentioned that this has been described as a shadow pandemic. 736 million, a figure so large as to be virtually incomprehensible. 736 million women, and yet victimhood will have the effect of making each one feel entirely alone. Each one of these women and girls matter, but to count them would take you 194,000 hours, or 8,100 days, or just over 22 years. In the UK alone, according to police reports, there are an estimated 1.6 million victims of domestic abuse, and 8 out of 10 crimes of stalking, voyeurism, and online abuse are of women or girls. The police themselves have reported the figures as being eye-watering. So are we justified in requesting that governments treat the problem as urgently as they respond to terrorism? Well, in 2017, an estimated 26,445 people died from terrorism globally. But in the same year, more than 3 times as many women, 87,000, were intentionally killed. And 80,000 of these murders were committed by a partner, a former partner, or a family member. Though prevalence fluctuates, over the last decade, terrorism deaths have remained steady at about a quarter the rates of femicide. Now, I appreciate that this is a rather superficial view of the impact of terrorism, but no less superficial than I'm presenting concerning the impact of violence against women. Recognizing the global gravity of violence against women is important, yet it has failed to impel us to initiate the kinds of action needed to stem it. On the basis of lives lost alone, there is justification for the problem to be treated with the same urgency as terrorism. But I am not suggesting we equate domestic violence or violence against women with terrorism. I do not think women have need of more sensationalizing labels, and I am cautious about using terms that prevent perpetrators of abuse from recognizing themselves. Terrorists operate on the extremes of society, abusers in its midst. That said, I acknowledge that at the individual level, perpetrators often do indeed terrorize their victims. Key among my concerns about the use of this language is that terrorism is commonly understood as the aberration of normal shared social values, whereas, as our research shows, violence against women is linked to the normalization of aberrant but shared social values. The conflation of the two will not help us. Nevertheless, I want to explore the British government's counter-terrorism strategy to see what an approach might mean in tackling violence against women in practice. And firstly, it should be said, although I'm drawing on the UK strategy, this mirrors the EU strategy and UN guidance on terrorism. And as there are likely to be similar initiatives in many countries, I think what I have to say will be widely applicable. The counter-terrorism strategy has 4 interconnecting strands: prevent, pursue, protect, prepare. They call it the 4 Ps. Its primary goal is to prevent attacks by confronting and seeking to change the underlying beliefs and attitudes that fuel them. And as you have heard from Ross, the focus of Ni3's work is on the prevention of gender-based violence by doing just this, disrupting the social values and attitudes that fuel it, in our case, through the use of digital technologies. Imagine if the resources and actions set out in the counter-terrorism strategy were deployed to enable gender-based violence prevention initiatives to be implemented in every community and every school. Another key element of the counter-terrorism strategy is to improve support for victims of terrorism and to ensure a comprehensive and coordinated response. Improving services for victims of gender-based violence requires that we centre their voices. And while prevalence and survey data are important, this really calls for the kinds of mixed methods research we conduct at the Ni3 Centre. In generating research for the future, I want to make a plea for us to prioritise the minoritised. Though we must not forget that we stand for millions of women and girls, emphasising the scale of the problem can mean that research is too shallow. Improving support requires deeper understanding of the local contexts that fuel violence and the conditions that generate greatest need. Shallow research can airbrush these out. What I propose, therefore, is an approach to research which involves particularising the universal. What I mean by this is that researchers should examine this universal problem from the perspectives of women who may be at particular risk or in especially vulnerable circumstances. By consulting more deeply with specific groups of survivors, it is possible to find out which women are at particular risk, why, when, in what ways, and what should be done. To illustrate this, I'm going to refer to the research carried out in Barbados and Grenada that was the forerunner of the current project. In doing so, I pay tribute to Michael Barfoot, the former EU ambassador to the Eastern Caribbean, whose vision made that research possible, to Dr. Ina Trotman-Jemmett and Dr. Hazel Dabrio, who were the country directors, and Dr. Deborah Joseph, who was the lead analyst for our research with men and youth. And both Ina and Deborah are with me today. I'm only going to draw on qualitative research with disabled women, but it should be noted that the study also included women in same-sex relationships, women living with HIV, and women who experienced domestic violence while pregnant. So some key findings. Women with disabilities experienced intersecting forms of discrimination and inequality, and their risk of domestic violence was much greater than non-disabled women. Economic and physical dependency provided additional barriers to leaving a violent relationship. Social isolation related to disability compounded violence. It made it more likely, more severe, and reduced women's access to help. Women's impairments were used against them as a means of inflicting maximum psychological harm. For example, Aya, who was blind, told us that when her husband wanted to punish her, he would move all of her markers of space and place in the home so that she would stumble or have to call for his assistance. And when Kathy had a stroke, her husband became extremely abusive. But in addition to the physical and sexual abuse, the fact that he told people she'd had a nervous breakdown and was mentally unstable was particularly difficult for her because it meant that people changed the way they related to her. Negative attitudes to disability resulted in a reduced sense of self and seemed to give men an increased sense that sex was theirs for the taking. One woman explained, "My body isn't in the best of health, and with my medication, the doctor told me I'm not going to crave to have sex. So he forced himself on me." And another said, "He would tie me up to the bed and have sex with me." The women in our study were unable to access services and justice. Sometimes they were not physically able to get in to a courthouse, and they had no independent means of getting to a police station to report abuse. So in particularising this universal problem for disabled women, a clear direction for policy and programming emerged. Policy must reflect the fact that women with disabilities are at an increased risk of discrimination, of inequality, of exploitation, and of domestic violence. Disabled women need access to housing, employment, and income in ways that support self-determination and the exercise of agency. Criminal justice systems need to be designed with disabled women in mind if they are serious about tackling gender-based violence. Accessible courts, sign language interpreters, independent advocacy, as a matter of course. There is need for increased sensitivity by professionals to the needs of disabled women and their inclusion in crafting policy and programs. Interventions should be strengths-based rather than deficit-based. Women told us that they would welcome routine opportunities to discuss domestic violence and general well-being during health checks. Chronic abuse generates multiple barriers to escaping violence, and professionals need to appreciate that effective support is not just about the crisis. Sometimes long-term support can be needed. The women were deeply concerned about the impact on their children of the violence they had witnessed and wanted help for them too. Their experiences were exacerbated because of a high level of tolerance within families and communities. More than half of the women in this study, there were 49 women in this study, had experienced sexual abuse as children, and almost all had witnessed their mothers being abused. There was therefore clear need for sustained integrated action on the part of child protective services and women's services that recognise that violence can affect women across the lifespan. When we particularise the universal, we are more likely to be able to initiate changes that will not only benefit particular women, but lead to changes that can benefit all women. For example, training health professionals and the police to be more sensitive will increase their sensitivity overall. Imagine a world in which not only the needs of disabled women are recognised, but also those of trans women, women in prison, women refugees, older women, women with mental health problems, women sex workers, gay women, Dalit women, adolescent women, minority ethnic women, black women, poor women, rich women. For aren't these the worlds we live in? And we don't have to stop there. We can take particular research findings and we can universalize those. This means looking at cross-cutting themes to see where a common approach is needed to protect all victims of violence. This takes us back to the strategy for counterterrorism. In the following slides, I've pulled directly from the text of the UK government's counter-terrorism strategy document, and I have replaced the word terrorism with violence against women. And I hope this will help to articulate the steps I believe are necessary to take us forward. So here are some of the actions that are being implemented by the UK government for terrorism, and I suggest we might consider adopting these for violence against women. Develop a series of multi-agency pilots to trial methods to improve our understanding of those at risk of involvement in violence against women, enable earlier intervention. Focus activities and resources in those locations where the threat is highest. Expand programs to increase the number of individuals receiving rehabilitative interventions. Reinforce safeguarding to ensure communities and families are not exploited or groomed into following a path of violence. Regularly test and exercise the multi-agency capabilities required to respond to violence. Improve support arrangements for victims and ensure a comprehensive and coordinated response. Share information more widely, support local interventions, and enact new legislation to ensure the police have the powers they need to intervene at an earlier stage in investigations, to increase prosecutions, and to improve the management of offenders after their release. Supported by an annual budget of £2 billion, the British government states in their document that aggregated together, this comprehensive strategic framework, combined with its new priorities, its new approaches, and its planned new capabilities, will ensure the UK's response is effective in reducing violence against women. This was, of course, an exercise in imagination. But just imagine. Thank you.